Hello guys, how are you? I hope so that you will be fine. Today I have selected a topic on premenstrual syndrome. What is PMS or premenstrual syndrome? Premenstrual syndrome refers to the changes in mood and emotions, physical health and behavior that develops between ovulation and the start of your period, roughly the 2 weeks before your period. And it lasts until a few days after your period begins, and it shows up consistently each month, and it has some impact on everyday life and regular activities. PMS or premenstrual syndrome is a very common concern. Nearly 48% of women who are of the reproductive age experience PMS, and for about 20% of them symptoms are severe enough to affect their regular routine. Contrary to what some people suggest, premenstrual syndrome is a real condition, one that can disrupt daily life and cause significant physical discomfort and emotional distress. Below, we will cover the symptoms of PMS in detail, plus offer some tips on getting support and relief from your symptoms. So, what are the symptoms of PMS? While PMS often involves mild or moderate symptoms, that do not majorly affect daily life, symptoms can be severe enough to impact your everyday activities and overall well being. If you have PMS, you will experience symptoms consistently before each menstrual period. You might experience only some of the symptoms below or several, but PMS typically involves at least a few different symptoms. You might observe emotional and behavioral symptoms. PMS related changes in your mood, emotions, and behavior might include anxiety, restlessness, or feeling on edge, unusual anger and irritability, changes in appetite, including increased food cravings, especially for sweets, for chocolates, and changes in sleep patterns, including the fatigue or trouble sleeping, a sad or low mood, which might include tearfulness or sudden uncontrollable crying, rapid shifts in your mood or mood changes and emotional outbursts, and decreased sexual drive and difficulty in concentrating or remembering information. What are the physical symptoms? With PMS, you will likely notice some physical symptoms such as abdominal bloating, cramping, sore and swollen breasts, acne, constipation, diarrhea, headaches, back and muscle pain, unusual sensitivity to light or sound, unusual clumsiness. When do PMS symptoms begin? On average, the menstrual cycle lasts about 28 days. If you have an average length cycle, ovulation or the eggs released from the ovaries will occur around day 14 or the midpoint of the cycle. PMS symptoms can begin anytime after ovulation, though they typically begin in the week before your period and last until 5 or days after menstruation begins. Menstruation or bleeding will begin on day 28 of the cycle. So, what causes PMS? Scientific research has not led to a conclusive cause of PMS or an explanation for why some people experience it more severely than others. That said, researchers have suggested a few different theories. There is cyclical changes in hormones. Many experts believe PMS happens in response to changing levels of the hormones estrogen and progesterone in females, and these hormones naturally fluctuate throughout your menstrual cycles. And during the luteal phase, which follows ovulation, hormones reach a peak and then decline rapidly, which may lead to anxiety, irritability, and other changes in the mood. And what are the chemical changes in the brain? The neurotransmitters serotonin and norepinephrine have several important functions in the body, including helping regulate mood, emotions, and behavior. These chemical messengers may also be a factor into symptoms of PMS. For example, a drop in estrogen may prompt the release of norepinephrine, which leads to the declining production of dopamine, acetylcholine, and serotonin. These changes can trigger sleep problems and lead to a low or depressed mood. Existing mental health conditions. Living with a mental health condition such as depression or anxiety would raise your chances of experiencing PMS or premenstrual dysmorphic disorder, PMDD, or more severe form of PMS. A family history of PMS, bipolar disorder, or depression, including postpartum depression, can also increase this risk. You might also notice premenstrual exacerbation. This means symptoms of underlying mental health conditions like bipolar disorder or depression intensify shortly before your period begins. Experts have yet to arrive at a conclusive explanation for the link between the mental health symptoms and menstruation related mood changes, but many believe it relates to the chemical changes in the brain discussed above. And what are the lifestyle factors? Certain habits might affect the severity of your PMS symptoms. Potential lifestyle factors that could worsen PMS include smoking, eating a lot of foods high in fats, sugars, and salt, a lack of regular physical activity, a lack of quality of sleep. Research from 2018 also links alcohol use to increased risk of PMS. If you binge drink or drink heavily on a regular basis, you are even more likely to experience PMS symptoms. Could it be PMDD? As with PMS, PMDD, which is polymorphic dysmorphic disorder, symptoms may occur due to the fluctuations in the level of estrogen, progesterone, and serotonin. What are the symptoms of PMDD? These might include depression, intense sadness, and crying spells, thoughts of suicide, panic attacks, anxiety, anger, irritability, sudden shifts in mood, a lack of interest in daily activities, insomnia, trouble thinking or focusing, binge eating, painful cramping, bloating, having thoughts of suicide. It can be thou to talk about intense emotions or persistent thoughts of death, dying or suicide. But you are not alone. Even if you don't feel able to open up about your feelings to family and friends, get free confidential support by contacting a physician. Trained crisis counselors can help you talk through overwhelming feelings and practice new strategies to cope during a crisis. So if you have symptoms of PMDD, your doctor may recommend working with a therapist or psychiatrist, especially if you experience recurring mental health symptoms related to depression, trauma, or stress. Other treatments and coping strategies that may help include daily exercises, limiting caffeine, practicing new methods of coping with stress, drospirenone and ethyl estradiol tablet, the only birth control pill approved by FDA for PMDD symptoms, and antidepressant or anti-anxiety medications including selective serotonin reuptake inhibitors SSRIs or serotonin norepinephrine reuptake inhibitors SNRIs should be given. When to reach your doctor? Most people who menstruate report at least a few symptoms of PMS, but these symptoms would not necessarily show up every month or affect your everyday life. If PMS symptoms become severe enough to disrupt your regular routine on a monthly basis, a good next step involves reaching out to a doctor or a clinician. Healthcare professionals can diagnose PMS or PMDD and help you explore potential options for treatment such as hormonal birth control pills or supplement including calcium, magnesium, or vitamin B6 and mefenamic acid. To make an accurate diagnosis, they may ask about your personal and family history of PMS, PMDD, and other mood and mental health conditions. Ask about your family history of other health conditions including hypothyroidism or endometriosis. Recommend a pelvic exam to rule out gynecological conditions depending on your symptoms. Suggest keeping a diary, a calendar to track menstruation and any related symptoms you experience for 2 to 3 months. If you have symptoms shows up consistently during the luteal phase of the menstrual cycle and disappear shortly after your period begins, a healthcare professional may diagnose PMS. On the other hand, if they linger throughout the entire month or come and go without any regularity, they may link them to premenstrual exacerbation or another health condition. Other conditions that may involve similar symptoms include anemia, endometriosis, thyroid disorder, irritable bowel syndrome, chronic fatigue syndrome. Easing the symptoms of premenstrual syndromes, you can take 3 steps to ease your symptoms. To get relief from mild or moderate symptoms, it may help to give the following strategies as you will try. Drink plenty of fluid to ease abdominal bloating. This include herbal teas like red raspberry leaf or chamomile, which may ease cramping in the abdomen. Eat a balanced diet that includes plenty of fruits, vegetables, and whole grains. Consider cutting back on sugar, salt, caffeine, and alcohol, and chocolates, especially if you are particularly sensitive to their effects. Ask a healthcare professional about trying supplements like folic acid, vitamin B6, calcium, and magnesium to help reduce cramps and mood symptoms. Try getting more vitamin D via natural light, food, or supplements. Aim to get 7 to 9 hours of sleep each night to help relieve fatigue and improve overall well-being. Try to get at least half an hour of physical activity each day if you are able. Exercise can not only help relieve bloating and cramping, but it can also help ease anxiety and depression symptoms. Set aside time each day for self-care, which might include exercise, relaxation time to yourself or hobbies, or time for social interaction. Over-the-counter medications and treatment can also help reduce physical PMS symptoms. Options include pain relievers like ibuprofen, aspirin, acetaminophen, or mefenamic acids for head and muscle aches or stomach cramping, and diuretics to help relieve bloating and sore or tender breasts. Heat wraps or heating pads on your abdomen to relieve cramps. If you have severe mood symptoms that create complications in your daily life, cognitive behavioral therapy, CBT, or other therapy approaches can help you learn new ways to reframe and cope with the distressing thoughts and emotions. The bottom line is, if PMS symptoms affect your routine and quality of life month after month, and home remedies and over-the-counter medications make little difference, it's always best to connect with the healthcare professional. Severe PMS symptoms may require a more in-depth treatment approach, but they do often improve with treatment. A doctor or a clinician can offer more guidance, provide more guidance, and developing personalized treatment plan that makes a difference for you. Premenstrual syndrome is a collection of physical and emotional symptoms that start a week or so before your period. So it makes some people feel more moodier than usual and others bloated and achy. For some people, PMS can also cause mood swings in the weeks leading up to their periods. Mood swings involve a sudden unexplained change in mood. You might wake up in a great mood but find yourself becoming angry and irritable an hour or two later for no reason. Other emotional symptoms of PMS can include sadness, irritability, anxiety, and anger. Two related conditions may also make you feel moodier before your period. Premenstrual dysphoric disorder, PMDD, is very similar to PMS, but its symptoms are more severe and tend to involve emotions. For some, it causes intense mood swings that interfere with daily life. While recent research estimates about 75% of women have PMS during their reproductive years, only 3 to 8% have PMDD. And then is the premenstrual exacerbation, and this refers to when symptoms of an existing condition, including anxiety, bipolar disorder, or depression, become worse in the weeks or days leading up to your period. About half of all women who receive treatment for PMS also have either depression or anxiety. Experts are not sure about the exact cause of PMS, but it's likely the link to the hormonal fluctuation that happen during the second half of the menstrual cycle. Ovulation happens about halfway through your cycle. During this time, your body releases an egg, causing estrogen and progesterone levels to drop. A shift in these hormones can lead to both physical and emotional symptoms. Changes in estrogen and progesterone levels also influence serotonin levels, and this is a neurotransmitter that helps regulate your mood, sleep cycle, and appetite. Low levels of serotonin are linked to the feelings of sadness and irritability, in addition to trouble sleeping and unusual food craving, all common PMS symptoms. Mood swings are one of the most common and most severe PMS symptoms, and how to manage it. Track your symptoms if you don't already. Start keeping track of your menstrual cycle and your emotions throughout its different stages. This will help you confirm that your mood swings are indeed linked to your cycle. Knowing there's a reason you are feeling extra moody can also help keep things in perspective and offer some validation. Having a detailed log of your last few cycles is also handy if you want to bring up your symptoms with your doctor. And there is still some stigma around PMS. Having documentation of your symptoms might help you feel more confident about bringing them up. It can also help your doctor get a better idea of what's going on. You can track your cycle and symptom using a period tracking app on your phone. Look for one that allows you to add your own symptoms. You can also print out a chart or make of your own. Across the top, write the day of the month 1 through 31 days. List your symptoms down the left side of the page. Put an X in the box next to the symptoms you experience each day. Note whether each symptom is mild, moderate, or severe. To track mood swings, make a note when you experience any of these symptoms: sadness, sudden unexplained changes in your mood, crying spell, irritability, poor sleep or too much sleep, trouble concentrating, and lack of interest in your daily activities, tiredness, low energy. Hormonal birth control. Hormonal birth control methods. The pill or patch can help with the bloating, tender breast, and other physical PMS symptoms. For some people, they can also help with emotional symptoms, including mood swings. But for others, hormonal birth control can make mood change swings worse. If you go this route, you might have to try out different types of birth control before you find a method that works for you. If you are interested in the pill, opt for a continuous one that doesn't have a week of placebo pills. Continuous birth control pill can eliminate your period, which sometimes help eliminate PMS too. What are the natural remedies? A couple of vitamins may help relieve PMS related mood swings. A clinical trial found a calcium supplement helped with PMS related feelings of sadness, irritability, and anxiety. And many foods are good sources of calcium, including milk, yogurt, cheese, green leafy vegetables, fortified fruit juices, and orange juices, and the cereals. You can also take a daily supplement containing 1200 milligrams of calcium, which can find on website. And don't be discouraged if you don't see results right away. It can take about 3 menstrual cycles to see any symptoms improvement while taking calcium. Vitamin B6 might also help with PMS symptoms. You can find it in the following foods such as fish, chicken and turkey, fruits, fortified cereals. Vitamin B6 also comes in supplement form, which you can find on. Also, you don't take more than 100 milligrams a day. And then there is a way of lifestyle changes. Several lifestyle factors also seem to play a role in PMS symptoms, such as exercise. Try to be active for at least 30 minutes more days of the week than not. Even a daily walk through your neighborhood can help with feelings of sadness, irritability, and anxiety. Then nutrition play a part. Try to resist the junk food craving that can come with PMS. Large amounts of sugar, fat, and salt can all wreak havoc on your mood. You don't have to cut them out completely, but try to balance out these foods with fruits, vegetables, and whole grains. This will help you keep you full throughout the day and help avoid drops in blood sugar, which can make you irritable. But don't take the chocolate in your diet and caffeine in your diet. Sleep. Not taking enough sleep can kill your mood. If you are weeks away from your period, try to get at least 7 to 8 hours of sleep a night, especially in the week or two leading up to your period. See how not getting enough sleep affects your mind and body. Then stress should be managed and it can worsen your mood swings. Use deep breathing exercises, meditation, or yoga to calm both your mind and body, especially when you feel PMS symptoms coming on. What are the medications? If other treatment options are not helping, taking antidepressants may help. Selective serotonin reuptake inhibitors (SSRIs) are the most common type of antidepressant used to treat PMS-related mood swings. SSRIs block the absorption of serotonin, and this increases the amount of serotonin in your brain. An example of SSRIs includes citalopram, Celexa, fluoxetine, Prozac, and Sarafem, and the paroxetine, Paxil, and the sertraline, Zoloft. Other antidepressants that work on serotonin might also help treat PMS mood swings. These include duloxetine, Cymbalta, and the venlafaxine Effexor. Work with your doctor to come up with a dosage plan. They might suggest you only take an antidepressant during the 2 weeks before your symptoms tend to start. In other cases, they might recommend taking them every day. Finding support, your gynecologist might be the first person you turn for help when you start noticing mood change swings before your period. It's important that your doctor is someone you trust and who takes your symptoms seriously. If your doctor does not listen to you, search for another provider or a psychiatrist. You can connect to a physician in your area using the Healthline Find Care tool, and you can also return to the International Association for Premenstrual Disorders, and it offers blogs, online communities, and local resources that can help you find a doctor familiar with the PMS and PMDD. So it was all about premenstrual syndrome, and I hope so that this video would be very helpful for you, especially for women and who are experiencing premenstrual syndrome. If you like this video, then share this video with other individuals as well, and kindly don't forget to subscribe my channel, and have a wonderful nice day. Thank you for listening this video.